Good day, fellow panelists, and my sincere apologies for not being with you in person. Thank you for the kind introduction, Dr. Mona. I will speak about the implementation of the Marutsa Foundation charters for the religions of the world for palliative care. But first, I'll define palliative care and make sure we're all on the same page. So palliative care is the active, holistic care of individuals across all ages with serious health-related suffering due to severe illness, and especially those near the end of life. It aims to improve the quality of life of patients, their families, and their caregivers. It intends neither to hasten nor to postpone death, affirms life, and recognizes dying as a natural process. And this is the link to the definition, which has many other components, one of which I'll go into in a minute. Palliative care includes spiritual care. It includes the prevention, early identification, comprehensive assessment, and management of physical issues, including pain and other distressing symptoms, psychological distress, spiritual distress, and social needs. And again, it's on our website. The WHO reports that only 14% of people with palliative care needs in the world have access to services. Considering that deficit, the Pontifical Academy for Life and the Fondazione Marutsa in Rome brought together religious leaders, clinicians, patients, families, and children and older persons needing palliative care in 2015 and 2017. And from the rich discussions those 2 years, calling on faith and religious groups to declare that palliative care is the right of every child and every older person facing serious illness that's life-limiting or life-threatening. They created these charters, which are signed by representatives of all the world religions. The purpose of the charters was to encourage advocacy that dismantles the barriers preventing governments from providing children and older people with chronic or terminal illnesses with palliative care. The core principles of the charters emphasize that alleviating pain is a fundamental moral and religious duty, and that includes spiritual pain. They take a holistic approach, insisting that palliative care teams address physical, emotional, social, and spiritual needs, supporting both patients and their families. Both charters emphasize the fact that even when palliative care is available and accessible in a country, spiritual care is often ignored or misunderstood. Faith organizations are essential partners in palliative care and often reach into even the most remote areas of most countries, as you all know. The fact is, though, that these charters remain beautiful PDFs that have never been implemented 10 years later. And that's why the IAHPC has developed the Interfaith Advocacy Network, whose primary objective is to build an interfaith coalition of religious leaders who are knowledgeable about how palliative care can benefit their communities and who use their authority to confidently advocate for services with funders and policymakers. The secondary objectives are to identify faith leaders from all religions with an interest in improving palliative care, to assess levels of palliative care training in the formation of clergy of all religions, to co-adapt the PEPFAR messages of hope that were developed for HIV/AIDS, and a basic palliative care curriculum for religious leaders, to co-design and implement national advocacy strategies, to evaluate the effectiveness of including palliative care in faith and seminary studies. So the Interfaith Advocacy Network tackles misconceptions such as the fact that palliative care equals end-of-life care, that it's only for cancer, or that it's only the same thing as euthanasia or assisted suicide. It's none of those things. The result of successfully tackling those misconceptions is that there will be earlier referrals, spiritual pain will be addressed, and we'll have strong advocacy because we want to advance evidence that spiritual care benefits people of all faiths or no faiths, that palliative care faith leaders can access basic palliative care education, and that palliative care chaplaincy is a growing field around the world. So we've got our work cut out for us because right now the consequence of all these misconceptions is late referrals, so people aren't getting palliative care when they need it, preventable suffering, and no advocacy or weak advocacy for access. So thank you for your attention. Here are some of the references: Religions of the World Charters under marutsa.org, the Older People's Religion and World Charter, and this is the definition I was referencing. This is IAHPC.org, and you go to research, consensus-based definition of palliative care. So please stay in touch. This is my email, and I look forward to being with you in a couple of years.